Hi, it's Dr. Kostelnik here with Rooted Behavioral Education. I'm a clinical health psychologist and fellow vestibular patient. So today I want to talk to you about what evidence-based means. It's important to talk about in the context of vestibular disorders, and I'll tell you why. So evidence-based means that there is a body of research on something that consistently shows it to be helpful or not. And typically these studies are published in peer-reviewed journals, which means they're submitted to specific journals and peers of the people that publish them. So if I were to submit something to a peer-reviewed journal, my peers of clinical psychologists who specialize in health psychology would review it for content and methodology, and they'll give you feedback to make sure that the quality of these studies is high. So there's kind of a checks and balances. So what does this mean for the vestibular community? I'm all about trying evidence-based treatments first. And so there's evidence-based treatments for vestibular issues. It depends on the issue. Are certain medications maybe for migraine prophylaxis, vestibular rehabilitation therapy, and then there are behavioral health strategies and therapies that are evidence-based. So what does it mean once you've exhausted the evidence-based options, which for those of us in the vestibular community, with chronic dizziness, vertigo, imbalance, the evidence-based options can be exhausted rather quickly. So in my opinion, I think it's reasonable to move on to things that maybe haven't been studied on the vestibular population specifically, but maybe something related. So maybe a medication or some type of therapy hasn't been studied on vestibular migraine, but it's been studied on classic migraine. Or a behavioral health treatment hasn't been studied on Meniere's or superior canal dehiscence, but maybe it's been studied on chronic illness in general. So once we look at specifically the vestibular population being studied, and maybe there isn't any data on that, we might broaden our lens and look at more kind of related issues. So the reason why I think once you've exhausted evidence-based options, it's reasonable to try other things and even move to things that are theoretically might work, just from like a pathophysiology standpoint, anecdotal evidence. So maybe your doctor's clinical experience is he or she has noticed certain things in practice. And then lastly, just trial and error is because research studies are done on groups of people. So let's say we have a group of people with triple PD. And so we say, we're going to give this group of people with triple PD a certain medication, and then we're not going to give this group of people with triple PD the medication. That's the control group. So then we compare the outcomes. So say we find that the medication was helpful for the group who was prescribed the medication. The thing is that even with evidence-based treatments, research is done on groups of people. So we're aggregating group data to say, is there a significant difference between this group of people who got the medication and this group of people who didn't? However, that cannot predict if it's going to be helpful for you as an individual. So the treatment that might be helpful for the group of people with triple PD might not be helpful for you. The same is true in the opposite direction. A treatment that's not helpful for the aggregated group of people might be helpful for you. So I think once we've exhausted the evidence-based options, it's fair to move on and try other things that are kind of more off the beaten path. So that's point number one. Point number two is that vestibular research, it's considered a pretty rare condition, people with chronic vestibular issues. And so there's just not a lot of research funding because rare conditions tend not to get a lot of research funding. And so it's not to say that these treatments might not be helpful or might not be evidence-based. It's just that we don't have data to show that they are or they're not. So it's not that we can definitively say, okay, we've studied the heal your headache diet. We've done a randomized controlled trial. We've randomly selected participants and randomly assigned them to either like the treatment group or the control group. This would be the gold standard. And then found that it wasn't helpful. And then we replicated that a lot of times to show that it wasn't helpful. So that would be kind of robust data to show against something being helpful. It's just that we don't have those studies. So we can't really say that it's helpful or it's not. And I've been getting messages from people saying, well, this treatment isn't evidence-based or this treatment isn't evidence-based. And yes, that's true, but it's not that we necessarily have data saying it's not helpful for a group of people. It's just that the data doesn't exist. So I hope that that's helpful for you. So my personal approach to treating my vestibular issues has been to try evidence-based first by all means and kind of pick what fits with my toolbox and what's helpful for me, and then to move on and try other things. And some of those other things have been helpful for me, like the more anecdotal types of things, or even just trial and error myself. So I hope this gives you an idea of what evidence-based means and how it fits with people with vestibular issues. All right, if you want to find me, you can find me on Instagram, YouTube, Facebook, or at rootedbehavioraleducation.com. And I'll see you next time.